Look at initial assessment and evaluation for hypertension. This is mostly applied when probably you are seeing the patient for the first time. What are the things that you shouldn't miss out? Okay. What are the things that you shouldn't miss out if you are seeing the patient for the first time? So, is you are just trying to confirm the diagnosis. Okay. So you are trying to do accurate blood pressure measurement, evaluate the risk factors that the patient had that make them to have hypertension. You are checking to see if any other organ is involved or complicated. So first step is confirming the diagnosis. So accurate BP measurement. Use good devices, correct cuff size based on the age of the patient. You measure both arms. Sometimes you can tell the patient to stand up, you measure. They will lie down, you measure. So repeat measurements too, okay, to get the good value. So hypertension is diagnosed if office BP is more than 140 over 90 millimeter mercury or 135 over 85 millimeter mercury on home ambulatory monitoring. So that's what we got. So medical history is when you ask questions. I try to know the reasons why the patient has hypertension. Is there a family history? Did they smoke? Did they take a lot of alcohol? What type of food did they eat? Did they do exercise? The comorbidity is when you try to establish if the patient has another disease condition apart from the hypertension. Also, medication review, you are trying to see if they are taking some drugs that the side effects of these drugs is possible to raise the blood pressure. So also look at the symptoms, that's what the patient is complaining about: headaches, sweating, palpitations, muscle weakness. Okay. You also do physical examination, where on the general examination you look at the body mass index, weight circumference, you know. Cardiac examination, you are looking at the heart sounds, the murmurs, signs of left ventricular hypertrophy. Then blood vessel examination, and also eye examination. I'm trying to see if there's any complications in the eye. That's what hypertensive retinopathy. Okay. So you also do your lab investigation where you send for tests for serum creatinine and what glomerular filtration rate. You are trying to see how the kidney is functioning. You do electrolyte test, fasting glucose, and also hemoglobin A1C. Now you are trying to look at the glucose levels to establish if the person has diabetes. Then lipid profile too, urinalysis, and additional tests like plasma renin and aldosterone, plasma methamphetamines, and also the thyroid function tests. Okay. Then we also do tests for the various organs to see if there's any target organ damage for the kidneys, for the eyes, for the heart, and the rest of it. So this is what you should do probably when you are meeting the patient for the first time. And the patient is you are suspecting that the patient has hypertension.